cities and counties. According to the World Health Organization, we are now in a global pandemic. And one of the most important things we can do, according to the World Health Association, is to speak in one voice as one government. That's one reason we thought it was so important today for us to join here. As we move forward, it will be increasingly necessary and important that we are unified in our efforts across cities, across counties, and state government if we want to slow the spread of COVID-19, help the most vulnerable and at-risk individuals, and work together to protect our small businesses and our workers displaced by this event. I truly believe that this outbreak may be one of the most transformative and consequential events that we've had in this region and in this country. I also believe and know we will get through it. It will be hard. One thing that gives me great comfort is the leadership that I have seen at every level of government, starting with our governor. He has been a tremendous partner and leader with all of this in this room and across our region as we've been responding to this public health emergency. I would now give you Governor Jay Inslee. Thank you very much.
Good morning, and thank you, Mayor. You're doing a great job, and I know the nation's going to be looking at your leadership as we all in the country go through this challenge. I want to welcome everyone to the state of Washington, a place where people are very much united and active and confident in our ability to take strong measures to slow down the spread of this epidemic. I'm pleased to report that Washingtonians, and that's 7 million of us, have been acting very responsibly as leaders in their own lives to try to slow this epidemic. People are staying home from work when they are ill, as recommended. People are washing their hands. People are using their elbows rather than their hands so that we can reduce the social transmission of this disease. People are caring for their loved ones and encouraging senior citizens and those with compromised health to really question whether you should go out more than is absolutely necessary right now into public. I'm very pleased that the 7 million people in Washington, I think, are united themselves as being leaders in acting responsibly right now. And I want to thank all of those families and our first responders. I'm pleased that we have been able to work successfully to increase some of our support networks to our families that will be impacted by some of the dislocation of this. Yesterday, we announced some moves to increase access to unemployment compensation and workers' compensation. We've also announced measures to protect our vulnerable people in our long-term care facilities and retirement homes. But it is clear that our state needs a more vigorous and more comprehensive and more aggressive position if we are going to slow the spread of this epidemic. So today I'm announcing steps to help communities contain COVID-19. And when I do so, I have an understanding, talking to the scientific community, that this is not just your ordinary flu. This is a virus that the experts tell us are at least 10 times more potentially fatal than the flu. And this demands a response consistent with the nature of the threat. We have already lost 24 of our citizens, and we mourn their loss. And as of yesterday, we had 268 presumptive cases of this virus, with hundreds, if not thousands of more, who we know are on our streets who may not even know they have the virus. So starting today, I am ordering pursuant to my emergency powers that certain events in King, Snohomish, and Pierce County with more than 250 people are prohibited by order of the governor. These events that are prohibited are gatherings for social, recreational, spiritual, and other matters, including but not limited to community, civic, public, leisure, faith-based, or sporting events. Parades, concerts, festivals, conventions, fundraisers, and similar activities of that dimension are prohibited as we go forward. The 3 counties impacted have been chosen because they are experiencing significant community transmission, significant outbreaks, and they are large population centers. This prohibition could be expanded in the days to come, depending on the development of the virus. These counties could be removed at a future order as well. Now, in approaching to this issue, I think it's important to know this. This is an extremely dangerous event that we are facing, but we are not helpless. We have the ability to seize our own destiny and the safety of our loved ones by acting to do what is necessary and effective in reducing the rate of the spread of this epidemic. There is no magic silver bullet at the moment medically, but there is a very successful effort that we can take to slow the spread of this disease, and that's to reduce the social interactions that are not necessary in our lives. This is an effective tactic. It is at hand. All it requires is the will of active people to follow science and confidence that we're all in this together. And that's why we're taking these steps. I spoke with the Vice President about these strategies this morning. We've been in communication with the federal government on multiple levels, and they are going to be issuing some guidance shortly that is very much consistent with our thinking here in the state of Washington. I had a few suggestions to the Vice President. He's been very open to our suggestions over time, and we want to thank the agencies of the federal government that are assisting us in getting access to personal protection equipment and a variety of other things that the federal government is freeing from their stockpiles. These are not easy decisions. The decisions that we're making today and the decisions we probably will be making in the upcoming days are going to be profoundly disturbing to a lot of the ways we live our lives today. But I believe they are the right ones. They are the necessary ones. They are ones based on how we feel about our loved ones and their lives. They are based on science, and they're based on the fact that we're all going to work together to ameliorate the consequences for families and businesses. So I want you to know that in reaching this decision, it has been a weighty one. I've talked with our local and state and national leaders. I find a remarkable alliance and thinking that we share, and I'm very happy about the unity that we have on this issue. We've also consulted the world scientific community. We're very fortunate in Washington to have some of the best geneticists and epidemiologists and physicians in the world today. And they have helped us, but we've also looked at the experience of other communities to help us make this decision. We're starting with this prohibition through March for these 3 counties. It is very highly likely that that will be extended beyond March. But that can be decided at that time. I want to make some comments about other things that we can do. And I want to reiterate that we are all leaders here, and the kind of things I'm going to talk about here are things that we can all do to pitch in. First, we can really remind high-risk populations that this is not a time to be going out into public and close contact. It's just too dangerous, and we need to help our loved ones think through that. I actually sent an email to my uncles, who I adore, today on this subject. I'm asking employers to make changes to how they do business. These include maximizing telecommuting options for as many employees as possible. We're doing this here in Washington. I've been very impressed by the creative leadership of the business leaders in Washington that are accommodating these needs. And people are doing it by the thousands in the state of Washington while keeping our businesses running. Now, we know there are many, many, many people who cannot telecommute. But those who can, we ask to explore those opportunities. We are asking business leaders to embed into their organizational systems social distancing. Now, this may seem a fairly benign thing, but it is a key to the success in slowing this epidemic. And we are asking business leaders to think today how you can reduce the distance of your consumers, your customers, and your workers. in a way that can possibly allow you to continue. And we ask people to be creative and aggressive in this regard. This is key to our success. And I hope all business leaders in Washington State, from restaurants to large manufacturers, to think about that request. We may have more to say about some of our systems in that regard a little later. I'm asking our public transit officials to follow King County's lead on additional cleaning and sanitizing. And I know that they're doing that significantly right now. We have other things that all of us need to think about. Now, we're going to fight this epidemic as much as we can, and the reason is we do not want to see an avalanche of people coming into our hospitals with limited capacity. We have a solid plan for increasing capacity as far as possible to accommodate what could be thousands of people who need serious medical attention. But that will be stretched at best. So all of us have to think about ways to be creative to both increase that capacity and reduce the demands on that system. So if in your discussions with your physician or your hospital, they discuss with you the advisability of delaying elected surgery, please listen to them in this regard. We may need real critical care for thousands of people in the months as we go forward. I want to talk about schools. People are intensely interested in this issue. We have been doing a very, very deep search into the science about how to reduce the transmission rates associated with our children. The good news is that our children are relatively free of serious disease associated with this. But the best science tells us they still have the capability of transmitting the disease to other people they come in contact with. And so we are giving intense thought about what we can do in regard to our children. In that regard, I'm asking all of our school districts to immediately begin contingency planning for potential school closures in the next several days. We are asking them to do so because we know they care about our kids, but we also know that the schools can help us on providing the nutritional needs for children if in fact closures are required, and they can help consider what we can do for childcare for parents if in fact closures occur. This is very important as we think about this, because we don't want to have nurses have to leave their employment at a hospital in the middle of an epidemic because they don't have childcare resolved. So we're asking our school district leaders to bend to this task of figuring out what we can do in the event we have to make these decisions. It is expected I will give more guidance in the next couple of days in that regard. And I'll be talking to superintendents of the three counties I've talked about this afternoon. So I want to, conclusion, thank Washingtonians for helping lead the nation. Unfortunately, we know that the rest of the nation will be where we are perhaps in a couple or 3 weeks. And we hope that the things we're doing aggressively here can set a template for the rest of the country. I've talked to several of my colleagues and shared our experiences to date, and we want to help the country understand how to have a very vigorous, successful slowing of this epidemic. So with that, I want to now turn it to, is it Dow, are you up now? I'm going to Dow Constantine, who's doing a great job as our King County executive.
Thank you, Governor. Thanks to all of you for being here today. Welcome to King County's King Street Center. This is the headquarters of our Metro Transit, as well as many other agencies. I'm joined by the Director of Public Health, Seattle and King County, Patty Hayes, and our Public Health Officer, Jeff Duchin. I'm King County Executive Dow Constantine. I want to start by expressing our sympathies, our condolences to those who've lost loved ones. Many of us now know families directly who've been affected by the coronavirus, and we want to express our concern for those who have confirmed cases and are recovering. I also very much want to thank Governor Inslee for his leadership and for taking strong, decisive steps to help stem the outbreak. As Governor Inslee outlined, the state and the counties and cities have been talking and cooperating and arriving with the guidance of public health officials at what we believe is the best set of steps to try to slow the spread of the virus at this time. And he, therefore, has ordered the prohibition of gatherings of more than 250 people. But we also agreed that gatherings smaller than that should not happen unless very clear public health recommended steps are taken. Therefore, our public health officer, Jeff Duchin, will be signing an order that prohibits smaller events of 250 people or less unless they meet public health guidelines to ensure social distancing, adequate sanitation, regular health checks of employees, and other measures designed to prevent the virus from being transmitted. Now, to be sure, ordering the cancellation of community events is an extraordinary measure, one made in a fluid situation in which new information comes to light hourly. I've connected with leadership of our professional sports teams, our businesses, large and small, as well as leaders of our represented workforce. And they understand that we must do everything we can together to protect our community. Temporarily banning social and recreational gatherings that bring people together will help ensure that a health crisis does not become a humanitarian disaster by working to preserve the limited capacity of the county's health care system. The governor mentioned this, and this is the core critical challenge: to delay the spread of disease, to reduce the peak number of people infected in order not to exceed the capacity of the healthcare system. That is a responsibility of every institution and of every one of us individually. We are seeking to take a targeted approach that still recognizes that it can be safe and it is vitally important for our economy to function. Business can and must continue. Restaurants, retail, music, arts, culture, movie theaters can and should continue if they are able to meet these criteria, the criteria that can be shown to dramatically reduce the transmission of disease and keep people safe. Our public health staff, our medical experts drive our decisions, using established and emerging science and data as our guides. As policymakers, we have to continue to ask ourselves if we're taking the most appropriate measures to meet the crisis. Well, today's actions will help relieve the strain on our hospital system. They'll provide people with options to keep their families safe and to keep the rest of the community safe from harm. You know, epidemiologists tell us that left unmitigated, the number of people with this infection roughly doubles every 5 to 7 days, and possibly quicker during this period in the disease's evolution. That fact underscores the urgency with which we are implementing these community mitigation measures, as well as purchasing, siting, and setting up locations, places for people to recover and to isolate themselves so that they don't inadvertently infect their families or others in the community. I want to thank Governor Inslee. I want to thank Mayor Duchin, the executives of our neighboring counties and all the mayors and our public health officials for uniting to tackle this shared challenge and keep our people safe. I also want to thank leadership from the business community. The governor mentioned this, but our business leaders have been absolutely tremendous in embracing public health recommendations and not merely complying, but finding ways that they are able to make their workforce and our public safer, and going beyond that. For employers like Microsoft to ensure that hourly workers will be paid even if they are not currently needed at the Microsoft campus so that they are able to continue to care for their families and keep a roof over their head. Those are the kinds of forward-looking measures that we need from all leaders, public and private, in our community. They understand, as do the elected officials in this room, that we are all in this together and that their leadership is critical to helping get our community through this. We must take time to be sure we get this right, but we have to, at the same time, act with urgency and leave no one behind. Thank you so much for joining us here today. Who's next? Okay. I mentioned that our public health officer is here with us. Dr. Jeff Duchin has been leading our efforts, providing the scientific advice that allows us to make policy decisions, and I'd like to introduce him to you now.
Thank you, Dan. Good morning. I'm Jeff Duchin, Health Officer for Public Health Seattle and King County, and I want to thank the Governor, Executive Constantine, Mayor Durkin, and all of our elected leadership for taking these important actions and ensuring regional coordination to protect our community's health. Today, as you've heard, we're taking unprecedented actions, and I want to fully recognize the disruption that these changes will cause in people's lives. We don't take these decisions lightly, but we're facing an unprecedented health emergency. Individuals, communities, and businesses, along with healthcare organizations, must all act together to protect our community. Everyone's participation is critical if we will be successful. Why are we doing this now? As you've heard, we recognize increasing spread of COVID-19 in our community. And as we bring on more testing, we're learning of more cases each day. The number of cases doubles every several days. And we've had multiple instances of COVID-19 in long-term care facilities where vulnerable persons reside. We expect a large-scale outbreak in weeks, and this will be a very difficult time. It's similar to what you might think of as an infectious disease equivalent of a major earthquake that's going to shake us for weeks and weeks. I want to, at this time, express my condolences to the families and loved ones of those who have been affected by this disease and who have passed at this time. I know this is going to continue to be a very difficult time for all of us going forward. The social distancing measures that you've heard about this morning are intended to slow the spread of the epidemic, although we know we cannot stop it. By delaying the number of persons who become infected and reducing the size of the epidemic peak, we'll be able to have lesser impact on our community and our healthcare system. And although most of us will have mild illness or moderate illness that does not require medical attention, there are many older adults and there are many community members with underlying medical conditions that place them at higher risk for serious infection that will require medical care and hospitalization. Evidence from past outbreaks and recent COVID-19 outbreaks in other countries strongly suggests that early, comprehensive, sustained social distancing measures are needed to minimize the number of infected people and the number of serious infections among older adults and people with underlying medical conditions that increase their risk. We all must help to make sure our healthcare system can provide the medical care to those who will need it by minimizing the number of people who become ill and the number who become seriously ill. But regardless of what we do, the healthcare system will be very stressed. The actions we take now can lessen the pressure on the system so that more people who require hospital care can receive it when they need it. We all have people in our lives who are at high risk for severe illness from this virus. We all have a lot at stake. By taking steps now and acting together, we're not only reducing our personal risk of exposure and transmitting this disease, but we are reducing the risk of severe illness for those who are most vulnerable in our community. We know that the actions that we're recommending will create hardships, and we need to do everything we can to support one another. This outbreak will go on for weeks and likely for months. I appreciate that our policymakers and nonprofit partners who are working now to make all people able to provide. I appreciate that our policymakers and nonprofit partners are working now to support all people to be able to comply with the steps that we are recommending. As Executive Constantine mentioned, I'm issuing a health officer order this morning making other important recommendations to our community. Consistent with Governor Inslee's order, all events of more than 250 people are prohibited, and my order also prohibits, in addition, events with fewer than 250 attendees unless event organizers can take steps to minimize the risk to participants. This order is not intended for grocery or other retail establishments or for family events. I want to say just a word about schools. I want to reemphasize that school districts should prepare now if schools were requested to close in the near future for weeks to months, and be sure to develop plans to continue to provide necessary services such as medical and nutritional services to those students who need them if schools should close, and to provide a place for students if they have nowhere else to go. All of our school districts, city and county governments should think about the unintended consequences of our actions and plan to support our community. We'll be making additional recommendations for schools, workplaces, and businesses, and community-based organizations for individuals and families, and reinforcing that guidance that we have already issued today and in the future. I encourage all of those groups to look at the new, recently released guidance from the U.S. Centers for Disease Control and Prevention on Community Mitigation that went up yesterday afternoon, and begin to think about how they can take those steps that are described. Who's next speaker? Oh, I'm sorry. Okay. So I'd like to now introduce to you Bruce Damier, the Pierce County Damier, Pierce County Executive.
Thank you and good morning. I'm Bruce Damier. I have the privilege of serving the people of Pierce County as their executive, and I am thankful to be joined today by Tacoma Mayor Victoria Woodards. We are thankful that we realize in Pierce County the vast majority of our community will come out the other side of this just fine, that their systems will rise to the occasion and that we'll get through it. I am particularly thankful that our youth seem to have an immune system that combats this very effectively. That is very important. But I am increasingly concerned about the seniors in our community, about young women who are pregnant, and about folks with compromised immune systems, that we need to be taking significant actions to protect them, because we also know that they are very vulnerable to this disease. So that's why I'm supporting these actions today in Pierce County. At the same time, we know that there's going to be consequences. And in particular, it is the season when many of our very important nonprofit community are holding their annual fundraisers. Tomorrow morning is the annual fundraising breakfast for the Emergency Food Network in Pierce County. The Emergency Food Network, as the name implies, is responsible for distributing critical food out to the food banks throughout our county. I think we all realize that probably now more than ever, perhaps, we need those critical pieces of our support to our community to be ready and out there doing that important support. So I'm calling on everybody in Pierce County, and certainly I think in the region, to make sure that we are supporting those critical nonprofits at this time. At the same time, Pierce County is culturally a rich and diverse community. And a key part of that community are our churches and faith centers. And this order will potentially impact many of them. At a time when church and faith is probably very, very important as our communities are confronting kind of uncertainty, some fear, some adversity, that connection to each other that faith communities offer is really going to be important. I am thankful that many of the churches and faith communities in Pierce County have already been planning for this. I can tell you that my own church is going to be live streaming their services so that they can continue to reach out and serve the people of their congregation, even at a time when they maybe can't come together for services. I'm thankful for that. This is a time when we need to redouble our efforts to care for our loved ones, our friends, and our neighbors. But I know we're going to get through this together. Thank you.
Good morning. I'm Dave Summers, Snohomish County Executive, and I'm joined here today by Mayor Cassie Franklin from the city of Everett. And the first thing, I would just like to say how incredibly saddened I am by yesterday's news about another COVID-19 fatality in our county. Our hearts prayers, thoughts go out to the family and all those affected there. Second thing, I would really like to thank Governor Inslee for his leadership. Governor Inslee is a good friend to Snohomish County. He was with us every step of the way during the OSO crisis. He knows our county. I've watched him in action. He takes advice from experts. He looks at the science. He knows the impacts of our actions on social impacts and economic impacts and balances those. So I can't think of a better leader to have in place during this event. So I have two priorities for the residents of Snohomish County. We want to save lives and protect our most vulnerable populations, particularly the elderly and those with underlying health conditions. As a biologist, I strive to have my decisions be science-driven also. When our health officers make recommendations, we listen to them. We must listen to them. We are going through careful, studied deliberation for every decision facing us, looking at whatever science is available and also looking at the impacts on our community. We are working hard to reduce, to the extent possible, negative impacts on our residents. The decisions announced today and those yet to be announced are serious. We know they have effects on people's lives. We know they're going to disrupt lives and impact people across our communities and our businesses. But we must take them to save lives and reduce the burden on our healthcare system. They are necessary actions. But it is important, you've heard this already, to remember that personal responsibility is the first line of defense and the first line of action here. I'm amazed as I drove in the lateness of the traffic, under an hour from Monroe, which is sometimes 2 hours. But our citizens and residents are doing an amazing job of taking personal action. I just want to emphasize that each of us is responsible for our health and our decisions and our families, and you're doing a great job. Keep it up. It's also important that we're working together as a region and with the state, our counties, and all our health districts and all our partners within the region. It's important so that our residents are getting consistent information from us and consistent action. The actions mentioned already in King County for smaller events, we will be mirroring those in Snohomish County so that everybody is playing by the same rules and people are not getting mixed messages. Just remind, if you're elderly, please self-isolate, take extra precautions, and if you have elderly or health-compromised people in your families, make sure you're watchful for them, advising them well, and taking precautions, as I mentioned. So we can use common sense approaches to keeping the community safe, and we will get through this as quickly as possible together with neighbor helping neighbor in our region and state united. Thank you.
Yeah.
I think we're questions.
I want to introduce Mayor Victoria Woodard of Tacoma. I wasn't sure if you got introduced, but thank you, Madam Mayor. Just a couple words before you stand for your questions. A lot of information is scientific, but some is anecdotal, and it all counts. My wife Trudy, was just showing me an email or a text from a woman in Italy. I spoke to our ambassador to Italy about what was going on in Italy right now. And I have to tell you, looking at that vision and thinking that that could be us is very, very disturbing to me. And that's one of the reasons we're taking action today. And some people continue to believe that this is some kind of minor problem and that there's an overreaction to this, that this is just kind of flu again. Here's an interesting text, and I'm going to edit it because there's some colorful language in it. Stop saying it's just flu or severe flu. Please come and see our intensive care units in northern Italy. People can't breathe, and we don't have where to put them, you blank idiots. We got to listen to science, we got to look what's happening here, and we got to act. And I'm just sharing good news with you in the America today. We can act, and if we do act, we can flatten the rate of this epidemic, and we can succeed. And it is not going to be easy. We are going to have to change our lives in ways that are uncomfortable if we're going to succeed as a community. And I am reminded at what Winston Churchill said during the Blitz is, all I have to offer you is blood, toil, tears, and sweat. And yes, we're going to have disturbances, but we are going to get ahead of this epidemic, and we are going to reduce the number of our loved ones that would otherwise have a fatal a loss to our families. And I just want to ask Dr. Duchin to come up and explain about what flattening the curve means and why we believe we can succeed here. Dr. Duchin, could you come up, and he's going to make reference to a study. And could you do this on the other side? Does that work? Yeah.
Okay.
Yeah.
So Governor Inslee has provided a graphic.
Hold on just a second.
Oh, Mike, I'll come to the mic. That's fine. Yeah, I don't need to be there. Jeff Duchin, Public Health, Seattle and King County. Governor Inslee has provided a graphic from one of our local researchers, Trevor Bedford at Fred Hutchinson Cancer Research Center. He's a modeler, and he's a evolutionary biologist and a geneticist. And basically what he shows here is that on about our date here today, he's estimating that we may have up to 1,000 cases in the community. And the blue line shows what will happen if we don't implement any social distancing or community mitigation measures to flatten that curve. The various other lines show that with social distancing and community mitigation measures that would reduce social interactions by 25% or more, we can see meaningful reductions in both the rate at which people become ill and the total number of people that become ill in a given time frame. Now, we obviously will need to implement these measures over a very long time, and people need to be prepared for that and understand how they're going to cope with reducing their ability to move about freely as they usually do and restrict their activities so that they will be less at risk of acquiring this infection and spreading it to others for many weeks to months. But it's really critical for people to understand this is a very serious disease. Okay, killing 10 times as many people as annual influenza outbreak is a very significant impact on our healthcare system and our community. So we want to do everything we can to decrease the burden that would represent on our healthcare system so that as people become ill, they don't become ill in as short a time frame that would stress the system. So more people ill over a longer time frame allows the healthcare system to manage those people who need to be there. The more people that become ill in a short time frame, the more difficult it is for the healthcare system to meet all their needs. So this is critical information that we have from our colleagues here, but it's also very consistent with what's been observed elsewhere in the world where these outbreaks have started, they've accelerated, and then social distancing measures were put in place that led to reductions in the rate of infections and the total numbers of infections. And we've seen that in China, for example, those communities that put those measures into place earlier did much better than those that didn't recognize the outbreak until they were way up on that curve.
Thank you, Doctor. I want to just to give people a scale of what we potentially could be looking at. This is a model that goes through April 5th, and it shows infections just through early April in the realm of 25,000 Washingtonians if we do not act. And that curve, unfortunately, continues to go up so that it probably continues to double every week or so. So by mid-May, we could be looking at over 60,000 people infected with the consequent fatalities associated with this. This is something we need to act on, and with that, I'd be happy to stand for your questions. Yes?
Governor, how does any of this get enforced, and how does this also apply to, say, airports and casinos, where there are more than 250 people at one time?
So this is an order by the governor, and the governor has the ability through an emergency order this. This is legally binding on Washingtonians. It is statutorily not only allowed, but I think required under these circumstances. And we fully expect that all Washingtonians will comply with this order. And the reason we're confident of that is, one, people are showing greatly responsible behavior so far. And we know the clear science on this, and we're very scientifically literate people in Washington State. So I am confident that Washingtonians are going to accept this order and going to abide by this order because they understand the consequences would otherwise be severe to their loved ones, and that's what really counts here. Now, enforcement is, I guess what I'm saying to you is we don't expect enforcement to have to be involved. We're accepting the good judgment of Washingtonians to follow that, and I believe that's going to happen. Yes?
As far as airports and casinos, though, follow-up.
This is not shutting down airports. There's some treaty issues on particular tribal things we're having further discussions about with the tribes on it. Now, let me back up, though. Just say, this is an order. If somebody is consciously avoiding it, willfully, and the state knows about that, there are measures to have legal means to stop that from happening. But I don't believe people are going to do that. I had a discussion with John Stanton the other day of the Mariners, and missing a home opener is a big, big deal to the state of Washington. But I think he and others understand the importance of health, and I think we're going to have acceptance of this. Yes?
Can you or somebody explain how we got to the 250 number? Like, how was it decided 250?
Yes. The question is, why 250? First off, there is no magic number written in the stone tablets, and any number is to somewhat degree not precise in any algorithm. What we did after long consideration, talking to local leaders, talking to scientists, talking to the CDC, concluded that this was a level that you really, if you have a gathering over 250, you really can't control the crowd to do social distancing. Below 250, we thought probably business owners, organizers could take measures to keep people apart. We do not want to see people shoulder to shoulder in bars from now on. That is just totally unacceptable. And we thought over 250, it would be impossible to exercise those type of reasonable measures. I appreciated my discussion with the Vice President on this subject today. I think you're going to see some guidance from the federal government that is pretty consistent with ours in this regard. Yes?
Governor, will you be using the National Guard, calling them out as the Governor of New York has done? They've set up a containment site. That's not being done here. But will you employ the National Guard?
Yeah, that containment discussion is a little misnomer. I listened to the mayor of, is it New Rochelle, I believe, today. It's less a containment zone than it's sort of been portrayed. But yes, we have a great National Guard. We'll use them as necessary. We've been having the National Guard helping in our EOC today, and they're doing a great job. We'll use them to supplement where we need, the sort of logistical help and the like. There is also potential medical assistance through the Guard on an emergency basis if our hospital system becomes stretched, possibly. So the answer is yes, as necessary.
Governor Inslee, we have a lot of parents asking about schools, and you addressed
Yeah.
that briefly. It sounds like you're laying the groundwork for possible closures coming down. So what advice do you have for parents who maybe have the opportunity to keep kids home? Is that something you recommend? What are health experts saying?
We should ask the health experts, but I am asking the school leadership to take action today to become prepared so that if that is necessary, they will have good plans to accommodate the needs and problems that parents will be involved with, including childcare, including nutritional efforts, because about 40% of our children now are fed through the school system. We actually are having some fairly successful efforts on an area that's now shut down here north of Seattle in that regard. What I would recommend to parents is first, don't go to work where you work if you're ill. Wash your hands. Talk to your grandparents and your uncles and aunts and encourage them not to go out in public more than is necessary. And then listen to us as a community for further recommendations. As I've indicated, we do need the schools to be thinking about this beginning right now, and we'll have more to say in the next few days.
Governor, you mentioned
Just hold on a second. We're just going along here. Yeah, go ahead.
how far does this extend to personal events like parties, like weddings, like funerals, and then what are the penalties exactly for not abiding by the ban?
The penalties are you might be killing your granddad if you don't do it. And I'm serious about this. The principal reason this is going to work is for people to understand the consequences of lack of community responsibility. And if you're thinking of having a 1,000-person wedding right now, you can't do that legally. And the reason is because we care about the grandparents that might attend. And so that's the principal motivating force here. So it does apply to social gatherings and family gatherings, and of over 250. And what King County has done is to say if you have an area below 250, some social event, we want social distancing to the extent humanly possible.
Can we get the criteria
Yes.
that are going to be enforced?
I'm sorry?
For people, a question for Executive Constantine.
Yeah.
How is that going to be enforced, and are you talking about restaurants, or are you talking about?
No, the 250 number is not about restaurants, but we are going to have specific guidance for restaurants and grocery stores and other institutions. The enforcement is going to primarily be by complaint. There's not going to be a set of public health police running around looking for gatherings where all of the public health recommendations have not been implemented, because we don't have that many people, and they're focused on community-wide efforts to prevent the spread of disease. We will rely on our cities. We will rely on businesses, and mostly, as the governor said, we will rely on the good sense and the good faith of the people of this county to recognize when they need to take action to protect themselves and others.
Executive Constantine or Dr. Duchin, can someone clarify what the criteria is going to be
Yeah.
for the King County?
That's
order?
you. Sorry.
Yes, so for gatherings under 250 attendees, we will require that older adults and individuals with underlying medical conditions that may increase their risk of serious COVID-19 be encouraged not to actively be encouraged not to attend. That would include employees as well. That social distancing recommendations will be met, and an example of that is to limit the close contact of people within 6 feet, but depending on the specific situation, we can work with the group and try and find something that makes sense based on the specific type of gathering that's being planned. We want employees to be screened for coronavirus symptoms each day and excluded if symptomatic. For organized events, we want to make sure that proper hand hygiene and sanitation are readily available to all attendees and employees, and that the organization and the sponsor is following the environmental cleaning guidelines from the U.S. Centers for Disease Control and Prevention. Those are the requirements that we would. So basically, the idea.
Is it temperature? Is that what
Cleaning. Oh, screening for symptoms. Yes. So it could be fever, cough, shortness of breath, sore throat. Depends on what type of gathering we're talking about. But the bottom line is, we realize we can't stop everything from all people from getting together in the community. We don't want to. I mean, life has to go on. People need to go about doing essential things that they need to do in the community. What this is all about is decreasing the bringing together of people that is non-essential, that provides an opportunity for this disease to spread. We understand it's not 100%, and it doesn't have to be. The whole idea of community mitigation and social distancing is you use a variety of strategies, none of which are 100% in and of themselves, but together, layered. Recommendations around schools, workplaces, community, businesses, and these types of gatherings together provide a meaningful amount of protection. So it's multiple layered strategies. We understand that no one of them is going to be 100%, and that's expected.
This lady had a question.
What is the county doing to support community clinics where some of the most marginalized people will be seeking help?
Yeah, so our healthcare provider community in general, we've been trying to get them as much information we can about the evolving guidance that comes out about this new disease from our colleagues at the Centers for Disease Control and Prevention. So guidance on how to prevent people who don't need to be there from coming in. This is critical. The message that everyone should hear right now is if you don't need to be in a healthcare setting, don't go. And that's both for people who are ill, who don't need to see a physician, can manage their symptoms at home, but also for visitors. We want people to understand this is not a good time to be visiting any healthcare facility unless it's essential. So providing real strong guidance on triage, so phone systems and other ways to get information to their patients to help them understand whether or not they truly need to be there. And then guidance around infection control measures that can be taken to prevent the spread both to other patients in the setting but also to the healthcare providers. Guidance on how to screen and identify those people who might be at risk for this disease. And very happy to say we have more testing available in the community, so where they can obtain testing. And then really another incredibly important piece of this is that everybody should understand that there's guidance now on our Washington State Department of Health website that tells the public, what do I do if I've been diagnosed with COVID-19 disease? What do I need to do to prevent risk of spreading that to others in the community and take care of myself? What do I do if I've been exposed to someone who has that disease and I have symptoms but I'm not yet diagnosed, or I think I might have that disease? How to keep away from others, isolate yourself, and then manage your symptoms appropriately. And then what do I do if I just have symptoms and I don't know if I've been around anybody or not? So all this type of guidance basically in the healthcare and in the community setting overlaps a little bit, and it's all focused on reducing the impact on the healthcare system and the stress on the healthcare system, and providing people with information that they can take personally with individual responsibility to prevent themselves from spreading that disease to others.
I want to mention, excuse me just a second here. People should know, too, that our state legislature is soon to appropriate at least $100 million to be available to help in a lot of different contexts. We have federal dollars. Our delegation has done a great job on a bipartisan basis. Money coming in, we expect that to be significantly helpful in a lot of contexts. Yeah.
What about public transportation? I'm thinking of ferry boats routinely have more than 250 people on them. And more broadly, can you just get at the significance of a liberal democracy taking what some would call draconian measures to control this outbreak?
Well, I just tell you, I don't feel it's draconian to try to prevent another 22 people to have to lose their grandfather or their uncle. I don't believe that's draconian. This is a very reasoned approach. It's based on science. It's based on a lot of input from publicly elected officials who are elected by their constituents. This does not apply specifically to transportation systems, but we are expecting transportation systems to do everything humanly possible in the social distancing realm, including, to the extent possible, have additional buses so we have more space on the buses. Our Department of Transportation is looking at how we encourage people to do social distancing while they are on the boats. So that is something we're going to intend to do. I just believe that we are acting both responsibly and we're acting in a democratic basis, which elected leaders are taking responsibility for this. And I got to tell you, this is not easy work. I wish I didn't have this on my shoulders right now. I wish it was on somebody else's. But it is our responsibility to protect our community, and I think we're doing reasonable things. Yes. Let's take, you had one here, right? Yeah.
With the estimate data right now, would you guys consider, or is that in the future possible worst case, the city gonna be shut down, like China?
Well, listen, that's exactly what we're trying to avoid. We do not want to be in a position that some of the China communities have been, or some of the Italian communities, and that's exactly why we're doing this, to not have to consider those things. Can you eliminate those things from possibly? Of course not. We can't. But let's be confident in our ability to do everything we can to avoid that. Yes?
Governor, I'm curious, what is your message to the Asian American community that right now feels very targeted because this disease originated when it was first discovered in China?
Listen, I really appreciate you asking that question, because we're very proud in the state of Washington to not allow fear or hate drive us apart or to in any way target any community, and that's an understandable concern. We're doing everything we can to encourage Washingtonians to be what we've always been, which is really loving of whoever you are and wherever you're from. I went to a good Asian American restaurant the other day to try to demonstrate the fact that we ought to continue to be friends with everyone in the state of Washington, and I will continue. And if anyone has an incident like that, you call me or Dow, and we'll work on it.
Last question. Is the homeless population at risk? Is the homeless population at risk?
I'm sorry?
Is the homeless population at risk, and if so, what's being done to help them?
Yes, we're very concerned about unsheltered people, and that's one of the reasons I'm glad that the legislature will shortly pass my proposal, or very close to it, to put tens of millions of dollars into helping the unsheltered people even before the COVID virus. But we are going to have, like I say, a minimum of $100 million available to help. We are intensely looking for opportunities to help the sheltered people who, A, need shelter and also potentially need to isolate themselves. Executive Constantine has done some good work looking for alternatives. In our state, we have adopted places to do isolation down at a former juvenile Rehabilitation Center. We now have people you can isolate safely in an RV, and we are continuing to develop those systems. Extremely important. I want to thank you. Be well. Wash your hands. Care for your family. Thank you.
Well done.
Speakers this way. Speakers this way, please. Speakers.
Your turn.
Now.
I thought I was the leader.
All right. Thank you.
They asked specifically for that, so yeah. Let's get it again.